The aim of this study is to use classification methods to predict future onset of Alzheimer's disease in cognitively normal subjects through automated linguistic analysis, and compare the linguistic markers to variables that could be measured during the screening period of a clinical trial. To study linguistic performance as an early biomarker of Alzheimer's disease, we performed predictive modeling of future diagnosis with Alzheimer's from a cognitively normal baseline of the Framingham study participants. The linguistic variables were automatically derived from responses to the cookie theft picture description task. We compared the predictive performance of linguistic variables with variables that included demographic information, genetics, medical history, and a total of 32 neuropsychiatric scores from 13 tests. The study included 703 samples from 270 participants, out of which a dataset consisting of a single sample from 80 participants was held out for testing. Half of the participants in the test set developed Alzheimer's symptoms before 85 years old, while the other half did not. All samples in the test set were collected during the cognitively normal periods, before onset of mild cognitive impairment. The mean time to diagnosis of mild Alzheimer's disease in the test set was 7.6 years with standard deviation of 4.9 years. In addition, a weekly labeled dataset was created from a separate cohort of Framingham study participants for training predictive models in a semi-supervised learning setting. Significant predictive power was obtained, with AUC of 0.74 and accuracy of 0.70 when using linguistic variables. The linguistic variables most relevant for predicting onset of Alzheimer's have been identified in the literature as associated with cognitive decline and dementia. The results suggest that language performance exposed subtle early signs of progression to Alzheimer in advance of clinical diagnosis of impairment.